Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Mansoor, head of the Department of Prosthodontics in Frontier Medical and Dental College, Ahmedabad. Today I will be taking online lecture on one of the components of partial denture known as rest. Now, what is a rest? Rest is any component of a partial denture on a tooth surface that provides vertical support is called a rest. This is a rest. This is a clasp, also known as a direct retainer, and this part of the clasp is known as rest. Now, the rest should always be located on a properly prepared tooth surface. The prepared surface on an abutment tooth to receive the rest is called the rest seat. This is a rest seat. If it is on the occlusal surface, it is called the occlusal rest. But if the rest seat is prepared on the lingual surface to receive the rest will be known as lingual rest. This is lingual rest. This one is occlusal rest. Then what are the functions of an occlusal rest? Why is it necessary to prepare a rest seat? The primary purpose of the rest is to provide vertical support for the partial denture. These are the rest. This is a partial denture. These rest provides vertical support to the denture. Therefore, the denture must not impinge on the soft tissues under the masticatory load. Another primary function of the rest is that it directs all the occlusal forces along the long axis of the tooth. This rest is directing all the forces along the long axis of the tooth, thereby preventing the orthodontic movement. Apart from the primary functions, there are few auxiliary functions of the rest. The rest maintains the components of the dentures in their planned positions and prevents spreading of the arm. You can see the clasped arms are maintained in their planned position. In the absence of the occlusal rest, the clasped arms will spread and will move towards the gingival tissues, causing trauma to the patient. The rest directs and distributes occlusal loads to abutments along the long axis of teeth, thus maintaining the health of an abutment tooth. It also provides reference for relining of denture or taking impressions. If there is a space between two abutment teeth and an occlusal rest is placed over there, it will direct food away from the contact area or the embrasure area. Occlusal rest also acts as an indirect retainer in class 1 or class 2 Kennedy classification, that is bilateral or unilateral free end saddles. In this case, which is a bilateral free end saddle, if the rest is placed on the lingual side of a canine, it will prevent the rotation of the denture, hence acting as an indirect retainer. It also improves the existing occlusion. There are different types of occlusal rest, which I will explain you one by one. The first three, occlusal rest, lingual rest, incisal rest, which are usually placed on molars, premolars, lingual rest on cingulum of canines, and incisal rest on incisal edges of canine and incisors, are according to their position, while the last three, extended occlusal rest, interproximal occlusal rest, and internal occlusal rest, are named according to their shape. If the rest is placed on the occlusal surface, it is called the occlusal rest. Here you can see these rests are placed on the occlusal surface, therefore they are known as occlusal rest. Similarly, if it is placed on the lingual surface, then it is called the lingual rest. And on the incisal surface, then it will be known as incisal rest. These are the incisal rests. This is an seat prepared to receive an extended occlusal rest. It is indicated in Kennedy Class 2 Modification 1 and Kennedy Class 3 situations in which most posterior abutment is a medially inclined molar. The advantage of an extended occlusal rest is to minimize further tipping of the abutment and ensures that the forces are directed along the long axis of the abutment. The extended occlusal rest should extend more than one half, this one, more than one half of the mesiodistal width of the tooth and 1/3 of the bungo buccolingual width. The preparation should allow 1 millimeter thickness of metal. The interproximal occlusal rest is indicated where the design of the clasp or direct retainer requires that interproximal rest must be used. The advantage of interproximal occlusal rest is that it will shunt away food from the contact points. Intracoronal precision rest are precision manufactured attachments placed within a crown or retainer. It has got two parts, a groove, this one is the groove, and this one is the latch. The groove is placed within a crown, while the other part, latch, is attached with partial denture, and when patient inserts the denture, the latch slips in the groove. Now, what should be the form of the occlusal rest and rest seat? The outline form of an occlusal rest should be rounded triangular shape with the apex towards the center of the occlusal surface. It should be as long as it is wide, and the base of the triangular shape at the marginal ridge should be at least 2.5 millimeter for both molars and premolars. The marginal ridge of the abutment tooth, this one, at the site of the rest seat must be lowered to permit a sufficient bulk of metal for strength and rigidity of the rest and the minor connector. This means that a reduction of the marginal ridge of approximately 1.5 millimeter is usually necessary. If it is not reduced sufficiently, it will break at the neck. The floor of the occlusal rest seat should be inclined towards the center, and the angle formed by the rest and the minor connector should be less than 90 degrees. This angle should be less than 90 degrees. And the deepest portion of the rest seat is always in the center. The floor of the rest seat should be concave or spoon-shaped to prevent horizontal stresses and torque. Now, what are the requirements of an occlusal rest? First of all, it should have sufficient thickness of metal to prevent breakage, especially over the marginal ridge. Number two, it should fit the rest seat accurately with beveled margins, thereby preventing food stagnation or impaction. The occlusal rest must not raise the vertical dimension of occlusion because it will be difficult for the patient to close teeth properly. This is improper form of rest. This is a proper form of rest. In bounded partial denture or Kennedy class 3, occlusal rest is this one. This occlusal rest is placed in the near zone of the occlusal surface, to the edentulous area. Whereas in free and partial denture or Kennedy class 1 and class 2, occlusal rest is placed in the far zone of the occlusal surface. It is placed here, not here. It is placed in the far zone of the occlusal surface to decrease torque action. This will be, if it is placed here, it will have a torque action on the abutment tooth. Then we come to the preparation of rest seat. It should be placed on a sound enamel. The preparation of occlusal rest seats should follow the proximal preparation. Occlusal rest seats are prepared with burrs and polishing points and then polished or smoothened by polishing points. The rest seat may be widened to compensate for shallowness, to give it rigidity. One should avoid weakening or eliminating contact points. Provide adequate bulk for strength, and occlusion must not be altered. Occlusal rest seats are prepared with round diamond or carbide number 2 or 4 burrs. Cingulum rest seats and guiding planes are prepared with long or medium diameter cylindrical burrs. Lingual rest on canines and anterior teeth. This is a lingual rest on canine, rest seat, and this one is the rest. The preparation of an anterior tooth to receive a lingual rest may be accomplished by preparing a slightly rounded inverted V. On the lingual surface, the angle should be less than 90 degrees and the apex of the V is directed incisally. The preparation should be at the junction of the gingival and the middle 1/3 of the tooth. This preparation is too high, whereas this one is too low. The preparation may be started by using an inverted cone-shaped diamond stone and progressing to smaller tapered stone with sound and to complete the preparation. Depth should be around 1 millimeter. The rest seat must be prepared within the enamel and must be highly polished. In preparing maxillary cingulum rest seat, avoid opposing occlusion. This is a correct position of the rest. This one is incorrect. Incisal rest and rest seats. Incisal rests are placed at the incisal angles of the anterior teeth and on prepared rest seats. Incisal rests are used as an auxiliary rest or as indirect retainers. An incisal rest seat is prepared in the form of a rounded notch at the incisal edge of a canine or on the incisal edge of an incisor. The notch should be beveled both labially and lingually. The incisal rest seat should be approximately 2.5 millimeter wide and 1.5 millimeter deep so that the rest will be strong without having to exceed the natural contour of the incisal edge. Thank you very much.